Well, hello. I'm here with Bobbie Bagley, Director of Public Health and Community Services, and together we are going to update you on the COVID-19 situation here in Nashua and the measures that we're taking and that we want to continue to take to try to keep everyone in our community safe. First of all, I want to mention that and I'm going to give you some specific numbers in a minute, but that the number of cases that we've seen in Nashua has definitely risen significantly now that we're in the cold weather in November. This is something that the scientists, the medical experts have been telling us for many months would happen, and it is happening across the country. We see huge numbers of new cases in the Dakotas and in some of the southern states, rising to levels that much higher than ever occurred before. Much higher than in New York or Massachusetts or Connecticut, some of the previous hotspots. In Nashua, we've seen the cases rise, as I said, as the weather has gotten colder, when viruses are more powerful and when people are more susceptible to catching these viruses, like similar to the flu virus or other related viruses to COVID-19. But I know that what you want from us is for us to be honest and straightforward about what's going on. You need us to follow the science, to talk with medical experts, and to act based upon the medical expertise and science expertise that we know is out there. And of course, you deserve us to do everything we can to protect people here in Nashua, protect our community. Now, right now, we have 295 active cases in Nashua. This is a lot more than we've had in the past. During the summer, we've been monitoring this all the way along. During the summer, we were down into 25 or 30 active cases at one time or another. More recently, we've seen a lot of outbreaks in schools, churches, in hockey clinics, in casinos, in other places around the city. And these outbreaks, of course, result in a number of cases. Sorry, someone's phone is ringing. In addition, we have developed, as a result of the 295 cases, and I think there's a slide that you're looking at, we have 316 contacts. So what happens is public health works with all of the patients who are positive and helps them through the disease. Hopefully they're not hospitalized. If they are, of course, the hospital and the doctors take over. But public health also carefully interviews each positive patient to determine who they have been in contact with in recent times, to try to determine who else might have been exposed to the disease. Then our public health nurses and volunteers get in touch with each of these so-called contacts to let them know you've been in touch with, you were in contact with someone who was tested positive for COVID-19. So we need you to quarantine. We need you to get tested, especially if you have symptoms. And we need to work with you over the next couple of weeks. You need to quarantine for 14 days, and we need to work with you over the next couple of weeks to make sure that if you develop symptoms, you get the treatment you need. That's called contact tracing, but it's a way to limit the spread of the disease because people who might be contagious are quarantined so that they, in turn, would not transmit the disease to someone else. Public Health has been doing a great job working 7 days a week for many months now, working with the contacts, the people who've been in touch with our unfortunate COVID-19 positive patients. We've had 40 people die in Nashua, very unfortunate. Each of these deaths is tragic for the family involved. It's a very grievous loss, and COVID-19 is a difficult disease in that circumstance where someone is that seriously ill, because often they're in the hospital, possibly on a respirator, family members often can't visit the COVID-19 patient who's suffering that much from the disease because they might be contagious, not only to the nurses and others at the hospital, but to family members who visit. So it can be a very lonely situation for the family, and the patient in that situation often is in an induced coma to get them on the respirator. So that we're trying to protect people from that course, that kind of disease course, and that's why we are asking that the community continue to make the sacrifices that you've been making, that we've all been making. And those things are that we are looking for people to wear your masks. We have a city ordinance that says when someone goes into a public place, a restaurant, a store, a mall, everybody should be wearing a mask. And the ordinance also suggests that the people who run the businesses require that customers wear a mask. And we know this, we're doing this because we know from the scientific research that's ongoing and continues to verify that the wearing of masks is very effective in helping to limit the spread of the disease. It protects you from someone else who might have coronavirus, might have COVID-19, but not know it because they don't have any symptoms. And if in turn you, the wearer of the mask, might have COVID-19 and not know it, it protects other people from potential transmission from you. So it prevents transmission in both directions. It protects you and it protects other people that you encounter. So wear masks, avoid large gatherings, definitely avoid large gatherings, especially indoors. Outdoors is a lot safer. Also, because of the wind currents and the like, the particles, the COVID-19 particles cannot hang in the air as much in an outdoor setting. And we also ask that you wash your hands and use hand sanitizer as often as you possibly can, so that if you pick up the disease on any of the virus on your hands, it doesn't enter your mouth or your nose and infect you. Now, there's another slide here that I think you're maybe looking at. Spread thanks, not germs, is what we've entitled it. So just to run through the items that can keep us all safe. Certainly stay at home if you're sick or you've had any close contact with anyone with COVID-19. As I've already said, avoid large gatherings, wear the mask, wear the face covering, avoid touching your eyes, nose, and mouth, especially if you've been out and encountered other people. Wash your hands frequently. Social distancing, keep 6 feet apart from anyone, especially indoors, but even outdoors where it is a little safer. Watch your symptoms carefully. If you come up with anything that's unusual, sore throat, runny nose, cough, sneezing, you should get tested for COVID-19 to see if that is the cause. It very well might not be. It could be just a normal cold or something, but it's important that you get tested if you have any symptoms. And as the slide suggests at the end, get tested under any of these circumstances. Now, so far, we've made a lot of sacrifices. We all have done that. I mean, I go out, I sometimes forget the mask, I have to go home, it's inconvenient, it can be uncomfortable, my glasses steam up, but by working together, when we've undertaken these sacrifices together, we wear the mask, we haven't seen our friends and relatives as much as we had before, maybe not at all. Those of us who have relatives, family members outside of New Hampshire, maybe we haven't seen them for the last 6 or 8 months. Maybe we won't see them over Thanksgiving or Christmas because traveling is, of course, hazardous with COVID-19. So we've made a lot of sacrifices, but we've done this together, and I'm very proud of the Nashua community, the way everyone has really pulled together to accomplish this. We have worn our masks, we've limited our travel, and in that way have protected ourselves and others in our community from catching COVID-19. Now, yes, the number of cases is up, But we know that we knew from the scientists, from the medical experts, that that was likely to happen in the fall, in November and in December. We knew that was likely to happen, but there would certainly be a lot more cases, more than the 295 that we have, if together we had not been making these sacrifices and working to protect the community. Before I introduce you to Bobbie, let me just reiterate that December, we may have more cases than in November. That's what the medical experts are suggesting, that the numbers could continue to rise. Remember, across the nation, yesterday, there were about 145,000 new cases. 295 of those are in Nashua. So as we enter the holiday season, Thanksgiving, Christmas, and the other holidays, you need to continue to be careful. Be careful about indoor gatherings, even with family members. The family gatherings sometimes spread the disease. When you get together with your family, if you do, consider wearing a mask, even indoors, even with close family members who don't live in the same household. We want to protect you. We want to protect your family members. We don't want anyone to contract this disease, or particularly a serious case. So if you have questions, you can always call the COVID-19 hotline at 589-3456. That's public health. If you need to get tested, you can call 589-3456 and talk with any of our public health nurses. Now, I'd like to introduce you to Bobbie Bagley, Director of Public Health and Community Services. She's heading up the city's anti-coronavirus efforts. She will give you some more details and just reiterate some of the things I've already said. And I just want to thank her for everything she's done for Nashua. And again, thank you for all of the sacrifices that I know you've made to help us limit the spread of this very dangerous virus. Thank you.
Good afternoon, Nashua, and thank you, Mayor Donchess. I do have some updates that I'd like to provide just to help give a picture of what's happening with COVID globally and nationally as well as statewide. So the mayor has already shared our numbers for Nashua. Right now, globally, we have 52.8 million cases around the world, and we've experienced 1.2 million deaths. In the United States, we've passed 10 million cases. 10.5 million cases is what's being reported currently. And our death toll has reached 242,000. 242,000 American family members, friends, co-workers have lost their lives to this virus. In New Hampshire, our case count right now is up to 13,470. We do have a 78% recovery rate. That number looks like it's going down a bit, and it's probably because the number of cases are rising. We've had 6% hospitalized, and that has increased over the past few months, and 4% have died. Our condolences go out to those families who've lost their loved ones, and it gets closer and closer to home when we're doing some of the contact investigation, disease investigation, and contact tracing. When we actually get to speak with these families and speak with some of these individuals who've been infected with COVID that then end up in the hospital, and as the mayor talked about, on the ventilators, in comas, and then some even succumbing to deaths. It's heart-wrenching, and it's very, very sad because this is very preventable. I wanted to share with you what we've been experiencing as far as our weekly cases and our average case contacts. And there's a slide that you'll see that shows how things looked for us in March when this pandemic first started for us here in Nashua, to where we are or where things looked at the end of last week, about November 8th. And on this slide, you can see how at one point, when we got towards the month of August, how we actually worked really, really hard And as the mayor said, we made a lot of sacrifices. Things were shut down, businesses were shut down, our schools closed. We did all of those things to flatten the curve and to stop the spread of this virus. And we had some successes. As it had been predicted, we expected that in the fall, because of the increase in activities, because we anticipated our schools opening, because of sporting events, because of the weather, we expected that there would be increases in cases. What we didn't expect is that this would exponentiate as quickly as it has. And you can see in the last couple of weeks at the end of October, going into the month of November, a huge spike in cases. I have another slide that lets you just see over the past 12 days what we've been experiencing with our cases and our contacts in Nashua, what our staff, our nurses, our community health workers, our repurposed staff at the division have been working on with regards to doing the disease investigation and doing our contacts with our cases. In the past 12 days, you can see how these numbers have increased tremendously with the number of cases and the number of contacts. And so much that in this past week alone, we've had over 260 cases just in this week alone. And today is just Friday. This morning, the governor talked about there could be an expectation of 1,000 cases per day. This morning, it was reported out that there were over 300 cases in New Hampshire reported. That's the highest number we've had since this pandemic has begun. So what are we asking? We're asking for all of our community to work together, to continue to make those sacrifices. And yes, they are hard sacrifices to make. We are seeing the impact of the isolation, of asking people to quarantine, on our families, on our friends, on our loved ones. We're asking that we can continue to do this because this will help us, again, stop the spread of this infection. Yes, we are still going to work very hard to flatten this curve. The prediction of 1,000 cases per day doesn't mean that that has to happen. But if we don't change something, it can happen. If we don't change our behaviors, if we don't change how we're socializing, these things can happen. But we can't stop it. The mask ordinance is one way. We are asking individuals to wear their masks when they're out in public, when they're out socializing, when they're out enjoying themselves with their friends. We're asking people to social distance. So what does that look like? At least 6 feet away from the person that you don't normally do things with when you're out in the public or in the community. We're also asking that people wash their hands frequently because the virus can only get into our bodies 2 ways, through respiratory droplets and through jumping on our hands and traveling to either our eyes, our nose, and our mouth. So we're asking people to wash their hands when they're out in the community. We're also asking for people to wipe down common surface areas when you're even in your homes or when you're in your job places. Use the hand sanitizers. Use bleach and water. Make sure that it's diluted, but wipe down those surfaces so that that virus is killed on contact. We're also asking that as the holiday season is coming upon us, that we think very carefully about how we spend our time with our loved ones, that we're not spreading the virus any further than need be. So for traveling safety and safely this holiday season, these are things that you can do. And we do realize and we do know that people are going to travel, but we want you to travel safely. Staying home is going to be the safest thing that we all can do. But if you have to get on the road, if you have to travel, if it's essential for you to see a loved one that hasn't been visited for a while, make sure you check the travel restrictions for the places that you're going. There is substantial spread throughout New Hampshire. There's substantial spread throughout the country right now. Make sure that you look at the number of cases and the rate of cases in the cities, the towns, the states, the places that you are traveling to, so that you know what you need to do to safeguard yourselves while you're visiting in those places. Wearing a mask is going to be very, very important, as the mayor talked about earlier. The mask protects you as well as the individuals that you are socializing with, because it stops the spread of those respiratory droplets. And individuals, if they have the virus and they don't know that they have the virus, wearing the mask is the best way to keep those respiratory droplets from traveling. Social distance. Again, keeping that space between yourself and others that you are not normally with throughout your time. And when you're traveling, make sure that you can maintain social distancing. And again, washing your hands when you're going into any of the stores that you may go into and the stops that you may make on your way in traveling. Make sure that you wash your hands. If you have to get on the road, the safest thing that you can do if you're going to is to drive in your own vehicle. If you take public transportation, a plane, a train, or a bus, those are ways that the virus can spread easily, and those are ways where transferring the virus from one to another is highly susceptible. If you decide that you're going to travel outside of New England, we do have travel quarantine in place right now. So there's two things that the state is looking at putting in place. Quarantine for 14 days is in place right now, or individuals can quarantine for 7 days and then take a COVID test, and if that test comes back negative, come off of quarantine. Of course, if the test comes back positive, then we're asking people to isolate for the 10 days that are needed for the virus to work its way out into recovery. We do have COVID testing every Tuesday that's offered over at the Elm Street parking garage. You can schedule your free COVID test by going on to our website. We do have a registration form that you can sign up there. You can also call our COVID hotline at 589-3456. If you have any questions, if the schedule seems like it's booked, give us a call and make us aware of the schedule being full if you're planning to attempt to get tested. There are also other testing sites that are available that we ask that people take advantage of as well in the Southern New Hampshire region. So check out our website for the listing of those sites if our testing clinic site schedules is booked. Again, we're asking Nashua, we've been working together since March. We've been able to successfully flatten this curve. We knew that we were going to head into these times right now that look very tumultuous for us, and we're asking folks again to work with public health, to work with our community, to work with your neighbors, to work with our businesses, because we want to be economically sound. We need our businesses to stay open. They can if we curb our social habits and make sure that we're wearing our masks, social distancing, washing our hands, and above all, that we're not going out to visit any of these places if we have any signs and symptoms of illness. They may seem very mild, a tickle in the throat, a headache, things that we don't normally equate with a virus such as COVID-19, but we are learning that those very mild symptoms can come back positive in testing. And so we're encouraging folks, if you have any of these, if you just feel off, and you just feel like there's something not right, please go and get tested to rule out COVID. It might just be a common cold. It might just be your allergies, but it also might be COVID. So please do that. Get tested. We want you to be safe. We're going to keep reminding everyone of these things. We want people to to take personal responsibility for the health and well-being of not only themselves, but also of their neighbors and their friends. We want you to be safe, Nashua. Take care.
Well, that is our update for today. We'll be back to you with more information soon. Have a good weekend, and please stay safe and continue to be careful. Thank you very much.